Understanding acne and getting rid of them. Everyone goes through it. Mornings of anguish in the discovery of a red throbbing acne on the face is something every person has experienced in their lives. While this may seem a disaster to some, others can take it just for what it is and calmly treat the acne to get rid of it. Everyone goes through it. Mornings of anguish in the discovery of a red throbbing acne on the face is something every person has experienced in their lives. While this may seem a disaster to some, others can take it just for what it is and calmly treat the acne to get rid of it. Acne is different from the common pimple because it could leave a permanent scar in your face, neck or back. This is how acne grows. When your skin pore starts to clog due to greasy oil and toxins, it starts to get inflamed. If left untreated, it could develop into an infection which could damage further the affected parts. It is evident on teenagers and young adults because they are reaching the puberty stage of life, where the levels of hormones causes some changes in the skin gland size, which causes larger amount of oil secretion produced by these glands, resulting to acne. Now, if your face does have mild acne, a minor treatment is enough to take care of it. Washing your face with mild soap and water is enough to free your skin pores from these oils, but other effective alternatives such as lukewarm water with dissolved salt is also recommended. Whenever you will use acne medications, be sure it is water-based. Oil-based products tend to stimulate oil glands to produce more oil rather than controlling it. If you have a severe condition of acne attacks, get medical assistance from a physician or a skin specialist. They can issue prescriptions of antibiotics to control spreading of acne and prevent the scarring on your face and other affected parts. Acne is regarded as a teenager's problem, but adult acne does happen as well. Many individuals above their 20s have had recurring problems with acne. This could be blamed on stress, overactive glands and eating oily foods. A dermatologist would be able to help you out if the acne persists, but keeping a clean, oil-free face, neck and back can certainly help a lot. Understanding acne and its devastating results. There are many days that get started off with a frightful scream or heartbreaking dismay from both men and women. The source of this shock and disappointment is an inflamed, greasy and oily clogged-up skin pore. There are many days that get started off with a frightful scream or heartbreaking dismay from both men and women. The source of this shock and disappointment is an inflamed, greasy and oily clogged-up skin pore. Acne is an unwelcome blemish on anyone's face. It can be quite painful too. If left untreated, acne can leave an unpleasant scar on the face, neck or back. Unlike the common pimple, acne can be inflamed and possibly turn out to be infected. Hormones that go into overdrive during the teen years of a person cause acne. They produce an excess of oil deposits in the glands resulting to this skin blemish. While they are not particularly life-threatening or are they extremely painful and disturbing, they can leave permanent scars in the affected area. Acne usually happens around the teenage years, from 13 to 19, and usually disappears thereafter. Different people have different levels or seriousness of acne infection. These will all depend on the amount of oils and dirt the face has. While some have minor infections that can be treated by simply washing the affected area, there are those that necessitate the consultation of a dermatologist or a skin expert. Acne may not seem to be a serious matter for some, but it is an infection that can greatly affect many. There are people with acne who locks themselves up in their rooms waiting for the acne to disappear. It is a serious blemish that they cannot show to the world. Every year, ointments and acne medication has estimated sales of over $100 million. This just shows how many people are dead serious in eliminating acne. Understanding acne in puberty stage. Puberty is one stage of our growing. Many growth and changes appears as we enter the puberty stage as well as acne. Puberty acne develops from a few simple steps. First, teenage acne occurs when for some unknown reason or combination of reasons, hair follicles, also known as pores, become blocked. Although the exact combination of reasons that pores become clogged may not be fully known, many contributing elements for teenagers and adults alike can include: Number 1, genetics, whether or not there is a history of acne problems and if so, to what extent. Number 2, hormones. Number 3, dietary and vitamin makeup or lack of deficiency. Number 4, stress-related factors. Other denominators in the development of puberty acne could include factors like how your body normally rids itself of its dead skin cells, and influences that may be working against this regularity. For example, climate and other environmental factors, overall body health at the time of the outbreak, and your hormones and their effect on your own body's sebum production, especially for females. Second, the normal dead skin cells that combine with your body's natural sebum oil as it drains through the skin's surface become clogged in these blocked pores. This substance becomes somewhat sticky, further clogging the passageway. Third, bacteria begins to grow around these clogged areas. As a normal reaction, your body's white blood cells attack the bacteria, fighting it and pushing it out of the body. And fourth, the resulting growths during this 14-day to 21-day battle are called microcomedones. Microcomedones turn into comedones, commonly referred to as blemishes, pimples or acne. There are basically 4 types of puberty acne: whiteheads, blackheads, pimples and nodules. Whiteheads are when the sebum, oil, and resulting bacteria are trapped below the skin's surface and you can actually see a whitehead appear above or near popping out of the skin. Blackheads are when the sebum and resulting bacteria are only partially trapped, slowly draining out the surface and turning black because of your skin's melanin or pigmentation. In the absence of either white or blackhead are generally, but not always, smaller pimples. And the often deeper, boil-like lesions are referred to as nodules. All forms of puberty acne can be mild, moderate or severe. Typically, mild puberty acne is visible in the form of whiteheads and blackheads, sometimes pimples. With moderate puberty acne, more pimples and pustules are present on the face, some may appear on the back or chest. And with severe puberty acne, many nodules develop, often large and sore, over parts of the face, back, chest and other body areas. This type of acne can lead to scarring. Actually, lesser cases of puberty acne have been followed by scarring. So for those with possible nodular acne, seeking advice from a healthcare provider as soon as possible is recommended. A gender issue to note is that males more often have the severe form of acne rather than females, due to their hormones. And the areas where they tend to break out most frequently are unfortunately more difficult to treat, the chest and back. Understanding acne scars to treat them and restore a fair look once again. This acne scar is not an ordinary scar. It has a S and car in it. Firstly, you have to see what model is your scar. The cost of treatment for certain types of scars is very costly. Therefore, before committing to treatment of acne scars, you should have a frank discussion with your dermatologist, in all the aspects. As, terminating the scar treatment at an incomplete stage, may be counterproductive for you. Acne scars are treated in several stages based on the type of. This acne scar is not an ordinary scar. It has a S and car in it. Firstly, you have to see what model is your scar. The cost of treatment for certain types of scars is very costly. Therefore, before committing to treatment of acne scars, you should have a frank discussion with your dermatologist, in all the aspects. As terminating the scar treatment at an incomplete stage may be counterproductive for you. Acne scars are treated in several stages based on the type of scar. They are like the episodes of a TV serial. Some stage of the story is covered in every episode, and a deliberate suspense is created at the ending. Here, the dermatologist may not deliberately try to keep you in suspense, but after completion of every stage, it is natural for you to have your quota of suspense. Will this scar fully heal? There is no doubt that innovative skin care technology for acne, bumps, surgery and piercing has arrived. The dermatologist will give you tens of reasons to get beautiful, getting rid of scars. He has documents of many success stories. You arrived at his clinic with scar removal temptation, and your temptation is now confirmed. He has explained to you doubt-proof methods to reduce and eliminate acne scars. Acne scars can affect anyone. After the healing process, the skin is left with a discoloration that may take months to heal. 6 to 18 months is the normal estimate. If the scar still persists, and is in no mood to go, then surgical methods are the only alternative. Since the scars are visible, they cause embarrassment. There is nothing to worry about the macules of sedulous scars. When it eventually disappears in the natural processing of healing, it leaves no trace. Post-inflammatory pigmentation is discoloration of the skin at the site of a healed acne lesion, which may last up to 18 months. Chemical peeling is likely to hasten the disappearance of post-inflammatory healing process. It is better to bear the scars if they are not in the visible part of the body. It is difficult to predict how successfully scars can be treated. 4. The healing duration differs from case to case. Acne scars are generally categorized in two types: scars caused by increased tissue formation and scars caused by the loss of tissue. The decision to seek surgical treatment is an important one. The type of treatment has to suit you best. The experience and expertise of the dermatologist come to play an important part here. He may fail sometimes, at your cost, despite of his best efforts. You have to make your personal decision whether to live in the company of your scars, unless it is a psychological burden for you. Scar treatment usually improves the appearance of the skin. But if your expectation is total restoration, it is an impossibility. The main aim of any acne scar treatment is basically to provide you a totally acceptable look. To have a complete restoration of your previous look is far than a possibility. Understanding and caring for body acne. One of the most frustrating and irritating skin conditions that can afflict a person is body acne. Indeed, when a person is afflicted with body acne, that man or woman, or young person, aches for relief from the condition that cause an itchy sensation in the best case scenario and pain in the worst of all situations. Left without proper and effective treatment, body acne can actually end up festering and causing infection and ultimately permanent damage to the skin. One of the most frustrating and irritating skin conditions that can afflict a person is body acne. Indeed, when a person is afflicted with body acne, that man or woman, or young person, aches for relief from the condition that cause an itchy sensation in the best case scenario and pain in the worst of all situations. Left without proper and effective treatment, body acne can actually end up festering and causing infection and ultimately permanent damage to the skin in the form of irreversible scarring. Therefore, if you are a person who is experiencing the early stages of body acne, or if you are in the midst of a full-blown body acne outbreak, it is imperative that you undertake a proper course of treatment. Primary causes of body acne. In many instances, there is not a solitary or primary cause for a body acne condition or outbreak. Rather, in many cases, a body acne outbreak is the result of a combination of factors, an acne perfect storm, if you will. One significant contributing factor to an outbreak of body acne is a lack of effective cleansing. By this it is not meant that a person fails to bathe. Rather, what is meant that in such a circumstance a person fails to utilize the right types of cleansing and body washing products that can work effectively to keep the skin clean as well as free from dead cell and oil buildup. Choice of fabrics can also be a contributing factor to body acne in some instances. Many people who are experiencing what is in fact a body acne outbreak assume that they are having some sort of more routine allergic reaction to a certain type of material. While on some level this is true, an outbreak of body acne due to a reaction to a certain type of fabric requires a different type of treatment regimen than what would normally be associated with caring for a rash that is the result of an allergic reaction. In some instances, a person's diet can contribute to an outbreak of body acne. There is a significant amount of dispute as to which types of food items might be a contributing cause to body acne. In the final analysis, the best way to avoid having your diet contribute to an outbreak of body acne is to make the best possible effort to eat a well-balanced diet each and every day. A final common contributing cause to body acne in some cases is the bed linen a person uses at night. In this regard, some people are a bit lax when it comes to caring and laundering their bed linens. As a result, bodily oils and dead skin cells can accumulate on bed linens, leading to an outbreak of body acne across a person's skin in some instances. Once again, you need to keep in mind that in most instances there likely is to be more than one contributing factor in the outbreak of body acne. Treating your body acne condition. The best course of action to take in the care and treatment of body acne is to develop and adopt a comprehensive treatment regimen. When it comes to body acne, an appropriate, complete care and treatment regimen should include: Number 1. The elimination or adjustment of the root causes of the body acne condition, for example, diet changes, clothing fabric alterations and a change in body cleansing products. Number 2. The adoption of whole body cleansing practices with soaps and washes designed to combat and prevent body acne. Number 3. The adoption of a whole body exfoliation routine. Number 4. The use of body acne treatment and cleansing products such as Zenmed Body Acne Combo. Because body acne can have a number of different sources, launching a full frontal attack on the problem as described in this article will be the best source to resolving the condition in the near future. In addition, by adopting a comprehensive regimen that includes the use of such proven products as Zenmed Body Acne Combo, you will be in a far better position to prevent future body acne outbreaks. If you don't completely eliminate future outbreaks, you will at least be able to effectively reduce the severity of such future body acne outbreaks. Conclusion. The care and treatment of body acne is something that you must take seriously. If you fail to adopt a comprehensive care and treatment regimen, you will fail in your attempts to treat and eliminate body acne. On the other hand, if you do adopt a truly comprehensive body acne care and treatment regimen, you not only will be able to deal with a present flare-up, but you will be well on your way to preventing future outbreaks of body acne in both the near and long-term future. Understanding cystic acne. Cystic acne is a common type of skin infection that is commonly found on teens. Understanding what cystic acne is can help you to better treat this condition on your own body. For many individuals, it is traumatizing in the way that their outward appearance is flawed by these small but powerful infections. The skin becomes inflamed here and it may even hurt. The irritants are likely to be bacteria as well as a combination of other factors. The bottom line is, though, that cystic acne, causes of cystic acne, acne products, best acne treatments. Cystic acne is a common type of skin infection that is commonly found on teens. Understanding what cystic acne is can help you to better treat this condition on your own body. For many individuals, it is traumatizing in the way that their outward appearance is flawed by these small but powerful infections. The skin becomes inflamed here and it may even hurt. The irritants are likely to be bacteria as well as a combination of other factors. The bottom line is, though, that people want and need results when it comes to treating cystic acne. What causes it? Cystic acne is caused by when the oil ducts in the skin become clogged. This will lead to the ducts, or pores, becoming infected. The oil ducts are overproducing oils that are generally need to help keep the skin moist as well as to help the hair follicle to ease out of the skin. Yet, for many teenagers, hormones are all out of control and this can cause these oil glands to simply produce too much oil. Eventually, bacteria find their way into this area and irritate it enough to cause the infection on the skin. This is what cystic acne is. Treatments for it. While the causes of cystic acne are important, the treatments for it are just as important to those that are suffering from it. Many individuals, mostly teenagers, will deal with this type of acne for at least several years of their life if they do have the right conditions for it. But, the good news is that there are acne treatments that really can work and work well for them. The best acne treatments are those that provide for all aspects of the condition. Number 1. They should treat the bacteria that are infecting the skin. Number 2. They should stop or slow down the production of oils through either destroying oil glands or through controlling hormone levels. Number 3. They should protect the face from new infections forming through methods such as cleansing and exfoliation. Acne products are available that can do any and all of these things. If you are like most, you'll want to get started on it right away. Start with natural acne products and then work on the acne treatments that are not working. You will soon see that cystic acne can respond to medication and treatment. Understanding the different types of acne. Before you can treat your acne, it may be to your benefit to understand that there are different types of acne. You should have a better understanding of your acne after reading this article. Though all pimples form the same way, they often take on different shapes and characteristics, and react differently on different people. Acne is formed when a hair follicle becomes clogged and what is called a comedo is formed. As the follicle becomes clogged with more oil, the comedo becomes larger, inflaming the skin around the area and forming what we know of as a pimple. There are several types of acne, each requiring different methods of treatment. This article covers some of those types, explaining each and making treatment suggestions. Non-inflammatory acne often takes the form of a closed comedo, or whitehead. This occurs when the plugged hair follicle stays beneath the surface of the skin, and appears on the skin as a small whitish bump. An open comedo, or blackhead, occurs when the plug enlarges and pushes through the surface of the skin. Its dark appearance is not due to dirt, but rather to a buildup of the dark pigment of the skin called melanin. Blackheads are also a type of inflammatory acne. The mildest form of inflammatory acne is a papule, a small, firm, pink bump appearing on the surface of the skin. These bumps can be tender to the touch, and are often considered an intermediary step between non-inflammatory and inflammatory acne. Pustules are like papules in that they are small, round lesions. Unlike papules, pustules are clearly inflamed and visibly contain pus. They may appear red at the base with a yellowish or whitish center. Pustules do not generally contain a great deal of bacteria, but are inflamed due to chemical irritation from sebum components. Nodular or cystic acne is usually very painful. Nodules are inflamed pus-filled lesions lodged deep within the skin. They develop when the contents of a comedo has spilled into the surrounding skin and immune system responds, producing pus. The most severe form of this type of acne may persist for weeks or even months, eventually hardening into a cyst. Both nodules and cysts often leave deep scars. Acne conglobata, a rare form of inflammatory acne, forms primarily on the back, buttocks, and chest. It is characterized by pustules and nodules, and severe bacterial infection may ensue. Acne cosmetica is a relatively mild form of acne caused from topical cosmetic products. It is characterized by small pink bumps, and local inflammation on the cheek, chin, and forehead. It may develop over the course of a few weeks or months, but usually does not cause scarring. Since it can persist indefinitely, it is important to find out which topical products are causing the problem and eliminate their use. It is important to understand what is causing your acne so a suitable treatment can be found. Before you can solve the problem, you must know its origin.